Are you struggling to fall asleep or at least stay asleep at night?
So many people have problems. More than a third of Americans are not getting enough sleep, and up to 70 million are dealing with a sleep-related problem. Our Dr. Ray McGeorge joins us now tonight with some expert advice to help you rest a little easier.
That's exactly it. You know, some of the most common sleep disorders are insomnia, sleep apnea, and restless leg syndrome. But many Americans are suffering sleepless nights without a specific diagnosis or even talking to their doctor about it.
Struggling to get a good night's sleep? Well, you're not alone. Cleveland Clinic sleep specialist Dr. Michelle Drerup says about 30% of adults have symptoms of insomnia. So how long should it take the average person to fall asleep?
Most people, if they don't have any sleep difficulties, probably fall asleep within 10 to 20 minutes. It varies as well. If it takes someone 45 minutes to fall asleep and that's normal for them and they allow enough time, it's not necessarily a problem.
When it comes to getting quality sleep, what you eat and how often you exercise can play a big role. Eating a diet high in sugar, saturated fat, and processed carbohydrates can disrupt sleep. On the flip side, eating foods that are good for your overall health can actually help with sleep. Dr. Drerup recommends avoiding caffeine starting in the early afternoon. Hitting the gym regularly can increase sleep quality and decrease the time it takes to fall asleep. Along with lifestyle changes, people can try using white noise like the sound of a fan to wind down. The goal is to make going to sleep a peaceful, routine part of your day.
When someone has sleep difficulties, they get anxious about sleep. They start to dread going to bed. And the more pressure you put, the harder you try to sleep, the least successful you're going to be.
Now, if you're having a persistent issue with sleep, take notes on your sleep pattern and talk to your healthcare provider. Lack of sleep and poor sleep can have a serious impact on your long-term health, so it's really important to address any issues as quickly as possible.
Yeah, and I think all of us then will look for maybe an over-the-counter aid or even a prescription sleep aid. What about those?
Well, you know, it can help in certain circumstances, but they're really meant to only be used short-term, and that's why experts generally recommend making those lifestyle changes first to see if you can solve your sleep problem without creating a reliance on sleep medication. But oftentimes, sleep medication can be a good short-term fix, especially if it's related to stress or some situational issue.
Yeah,
I like those essential oils. Do you ever try those? Like the lavender and the diffuser. And
it's nice.
just
Whatever
Different
chills you out.
Exactly.
And it's hard to chill me out, but it works. It works.